to best practice at home when you have gout and arthritis, or even if you just have simple muscle pain. So we're just going to give a short educational talk so that you can understand how it works and what you need to do at home, you know, to help aid, so that you don't have to go and wait for the doctor, you know, unless it's really necessary. So it's like a self-help type of thing that we are trying to install. So what we gave you was an anti-inflammatory tea, and we gave you a muscle bar. We will speak about that soon. The whole concept of what it is that we want to do is that arthritis pain, muscle pain, joint pain, gout comes from an inflammation in the area. So what we are trying to do through this process is to get the blood flowing, because healing is in the blood, Psalm says. So when your blood is flowing, it brings nutrients and healing properties to the area. And then it takes away all the inflammation and the toxins, and it drains it out through the lymphatic system. So and then Sean will speak more about that. So we first gave you an anti-inflammatory tea. So this tea contains turmeric, pepper, ginger, and honey. So turmeric, for example, is a strong anti-inflammatory, but it cannot work on its own. So it needs black pepper to help activate it. Okay, so on its own, turmeric won't be absorbed into the bloodstream. But when you use black pepper with it, there's a pepperin, is the active ingredient in black pepper. So the pepperin activates the curcumin, which is the active ingredient in the turmeric, and then it makes your blood absorb the potential of the turmeric, basically, so that it can do its work and help with the anti-inflammatory process, get all the toxins and push it out of the body. So then ginger also really helps a lot with joint pain and inflammation. You can also use ginger if you grate it, put it in, make a poultice by putting it in a cloth or something and put it directly on the joints. You can also do that. But the main aim is to work from the inside, because everything starts on the inside. So it's always good to drink the anti-inflammatory tea so that you get the things on the inside of the body working. Okay, so the ginger also then helps with the inflammation process, and it helps with mobility, and it helps to alleviate disability that is due to the pain from either the gout, the arthritis, or just general muscle pain. And then honey also has antibacterial traits, which also helps with joint inflammation. So that is the tea that we gave you. And so hopefully the process is starting from the inside out so that it's working. So after this, we will then give you a quick 5-minute massage. The aim of that is to get the blood to the area so that it can collect the toxins and inflammation and then move it out into the lymphatic system. Okay, and then Sean is going to explain how all of this works.
Okay, thank you, Cindy. Welcome everybody. This is a very important part of the day because I would suggest that you pay very close attention to this because it's all about education. You need to take home what you learned so that you can apply it, and the things that I will be talking about is very easy things that you can apply to yourself. Okay? My name is Sean. I'm a physiotherapist. Registered with the Health Professional Council of South Africa. And I'm just going to be talking about the differences between gout, arthritis, and inflammations, and what to look out for and how you can help yourselves at home. Okay? We want to have more of these programs, but we don't know when we're going to have it again, so please pay very close attention to this. Even the massage that we'll do, it's going to be a very light massage. But it's all about education. Even the massage is about teaching you how you can do this for yourselves at home. Okay. What we're going to start with is, we're going to start with, okay, Cindy already spoke about the anti-inflammatory effects of the tea. But some people don't even know what inflammation is. Okay? The reason we need to start with inflammation is because most of the time the pain that you're experiencing in the joints is because of inflammation. So we need to understand what is inflammation, why does it happen, is it good for me, is it bad for me, and how can I reduce the pain that is at my joints. Okay, that is the first step. Inflammation is, okay, let's talk about inflammation. So what is inflammation? Inflammation is a very essential part of your body's healing process. It's a way of telling you as well, the pain is there to tell you that something is wrong in your body. Okay? So what happens is when something is wrong, most of the time when something is wrong in the joints, inflammation will occur, the inflammatory process will occur. And what that is a buildup of fluid. The fluid will go to the area. Now, if you have a sore joint or something, you will see the first thing that happens is it swells, right? That is inflammation. If you break a bone or anything like that, it's going to swell up. That is inflammation. And what happens is it brings inflammatory cells to the area with cytokines and the body's natural way of healing. Okay? It's like if there's something strange. Okay, think about it like this. The body has an immune system. And the body is fighting all the time to make sure that you are functioning properly. So if something is wrong, it's going to go and it's going to try and sort out the problem. So it's going to bring all of the paramedics and the ambulance and the army, everything to that area to see what's wrong. That is what inflammation is happening at the joint. Okay? So it's bringing all of these cells, but because of all of that build-up and all of those things, it's going to be very painful for you. So it's going to limit your function. You're going to be in a lot of pain. And normally, this is the signs that we need to look for. Normally, inflammation happens between 5 and 7 days. And sometimes if it's too painful, we want to know what we can do for the inflammation. That's what we're going to be talking about today. So how do I know if my joint is inflamed? There are a few signs that we look for. The first thing is swelling. Like I said, swelling is a very quick sign to see. If you see on this side, you think something is wrong, look at it, compare it to the other half. So if my left wrist is sore, look at my right wrist and see, oh, this looks like it's a bit swollen. And if I touch there, it looks like there's some fluid under there. That is how we look for swelling. Then it can also become red, because that is also some of the blood that's going to the area. Obviously, it will be very painful, and it will have an increase in temperature. This is important because you need to be able to identify for yourself if there's inflammation in your joint or not. Okay? Before you get to the doctor, you need to be able to tell. So the first thing you look for, if there's swelling, or if there's an increase in temperature, if it's red, if it has those signs, then there's some inflammation at the joint. Okay, do we understand that? Alright. And if it's not controlled, it may become chronic, and no one wants to live with chronic pain, because then you just have pain all the time. So what we also trying to promote is just a healthy lifestyle, and it's all about quality of life. Pain really limits the quality of life. So you want to be able to do the things that you normally do, maybe go out walking on a jog or something. If you have pain, you're not going to be able to do that. Okay, so this is why we're talking about it. And inflammation is very important. If you're trying to determine if you've got gout, if you've got arthritis, the inflammatory signs is very important to note. Okay. So how do I control inflammation? Like I said, the normal response is between 5 and 7 days. If it takes longer than that, if it's already 2 weeks and your joint is already swollen, then something is probably wrong, even wronger. Okay, what we want to do when the inflammation sets in, we want to control the inflammation when it sets in, even on day 1. Very important, we start on day 1. The way that you can naturally control inflammation is with a rice technique. Okay, rice, it's not rice, it's just the acronym is what they call it. It's for R, I, C, and E. The R is for rest, the I is for ice, the C is for compression, and the E is for elevation. So what we want to do, because all of the inflammation happens now, it's all swollen, all of the blood is there, what we want to do, we want it to just drain away first and flush away, and then new cells will come after that. And so with that ebb and flow, it takes away all of the things that's not supposed to be there in the joint. Okay, and it also reduces pain very much. Okay, so the first thing, rest. So if my wrist is sore or my finger is sore, I don't want to use it all the time, because if I'm going to use it, the inflammation is just going to increase all the time. So we want to rest that. Okay, and Judy was talking about someone who had a sore finger, and all that she did was she told him just to wrap the finger around the other finger. So that is a way of rest. And the reason I said in brackets active rest is because it allows you to still do everything that you need to do. Okay, if my finger is sore, then I just quickly put something around so that it's resting all the time, and then I can continue with my day. Okay, and so with all of the other joints, that is rest. Then we have ice. Now what ice does is when it's cold, things normally like shrink. Okay, so what happens in the blood vessels also shrink when you put ice around the joint. So it will shrink, and what happens is it flushes all of those inflammatory cells and everything away. And then we apply it for 10 minutes, some ice around the joint, let the blood vessels shrink and let all of the swelling go away, and then maybe the swelling will come back, but that's normal. That's how we control the inflammatory process. Okay. Then we have compression. Now that is just, you can just put a bandage around there, maybe put it a little bit tight firmly. That also helps to drain the fluid away. So it helps with that constriction of the blood vessels, helps to flush it away. Okay. And then elevation. So elevation is also part of the flushing of the system. So draining the fluid away. If my right wrist is sore and I just keep it on a pillow or something while I rest, we normally want it to be above the level of the heart, because the heart is the pump. Okay, so then it will come down. Okay, and the swelling will come down. If it's my foot, when I'm laying on the bed, I want to put some pillows under my foot so that the fluid can also drain away from my foot. Okay, that is the RICE protocol for inflammation. Okay, the first one is rest, ice, second one is ice, third one is compression, and the fourth one is elevation. We want to do all of those things together for at least 10 minutes a day, at least twice a day, maybe once in the morning, once in the evening. We know some people is working, so even if you do it in the evening, that's fine. Alright, so that is inflammation and how to control inflammation. Now we're going to look at the differences between gout and arthritis, because some of you might be struggling with some sore joints, and sometimes it's gout and sometimes it's arthritis. So what is the difference between the two? Okay, so we're going to first look at gout. It's very common, especially in the elderly folk. Okay, so gout and arthritis are very different things in terms of what causes it. Okay, gout it's a buildup of uric acid in the blood, which causes inflammation. Uric acid, if you have too much uric acid, it starts to attack the joints, and it actually forms crystals in the joints, and that is very painful. And it doesn't mean if you've got gout, it doesn't mean you've got arthritis. Okay, and if you've got arthritis, doesn't mean you've got gout. Very different things. With gout, you will see inflammation. It will be red and it will be swollen, and your joints and things will start to be deformed as well because of that. So in that case, we want to apply the RICE technique to control the inflammation. The way that that is diagnosed is that if there are increased episodes of a gout attack, of inflammation in the joint, you probably have gout, but the way that they really do it, they test it, is only done by a doctor, your general practitioner. And what he does is he does a joint aspiration, so he will put the needle in there and he will draw some fluid out, and then they will test and see if there's any uric acid or crystals in your joint. That is how you can be officially diagnosed with gout. Okay? Only the doctor can do that. Right? But we are just showing you the signs and the symptoms of gout so that you can treat it on your own as well. Alright, and then the causes of gout is mainly due to diet. Okay, foods that are rich in purines. We're not going to go into the physiology of that, but we want to avoid things like organ-rich foods, organ meats like livers, brains, kidneys, also seafoods, shellfish, and red meat as well. Also, too much fruit can also cause gout as well. So we need to just be careful the kind of fruits that we have. But you want to have also a lot of vitamin C. I didn't put it in the slide, but vitamin C, you want to drink a lot of water as well so that you can flush out, the body can flush out the system effectively. If you don't have enough water, you're not going to be able to flush it out. Okay. There's been studies that show people who drink water before a gout attack reduces the reoccurrence of a gout attack, because normally when you have a gout attack, you will have it all the time. So just if you're struggling with gout, drink a little bit more water. Exercise is also very important. Okay, but we'll get there when we talk about the management. Okay, let's talk about arthritis. What is arthritis and how is it different to gout? Arthritis is basically degeneration of the joint cartilage. It has nothing to do with uric acid and a buildup of uric acid. It doesn't really have to do anything with your diet. Well, it depends. I'm not a dietitian, but the direct cause of it is not necessarily your diet. Okay, it usually happens. There's two types of arthritis. You get rheumatoid arthritis and osteoarthritis. Rheumatoid arthritis is it's an autoimmune response. So your body, we don't know why, just starts to attack its own joints for some reason, and the studies are still ongoing. And then the other one is osteoarthritis, and that is a general wear and tear of the joints in your body. Okay, and it's usually age-related as well. Also, if you're not moving as much as we should, exercising, that is also can be a cause of arthritis, because you're not using your joints. Okay, it's the principle: use it or lose it. You can apply it your whole life. Okay, and it's the same with the human body. If you're not using your arm, you will lose it, because there's no lubrication happening there. Okay, and the strength is also. Alright, age-related drugs as well. You want to avoid those kind of things. Okay, alcohol intake, I forgot to mention as well. Also rich in purines, you want to reduce that in gout. And yeah, drugs, self-explanatory. My sister was once diagnosed by a doctor, and the medication attacked the joints. So there's different causes for all of these kind of things. Okay, let's talk about the management of the condition. So the first thing we want to, if you're not sure what's happening, please consult your doctor. Okay, if you think that you have gout, like I said, the doctor is the one that does the joint aspiration, and he can diagnose you with gout. There are very specialized medications and things that the doctor can prescribe to you. We're not prescribing anything. We're giving you natural ways to deal with these things. Okay. And education. This is why we're doing this, so that you can understand what's happening with your body, with you specifically. You need to do research. This is why we're doing these kind of things, to educate you on these kind of conditions that are so common. Okay? And then you want to treat the cause. So this is why we're speaking about this. If it's arthritis or if it's gout, you need to determine for yourself, what is it that's causing my thing? Is it my diet that's very bad, or is it the lack of mobility? You will know for your life. Okay, this is why education is very important. And then treating the cause. If you're having too much salt, that's why we're doing all of this screening. For the blood pressure, if you know you're eating too much salt, you need to reduce your salt intake. Okay, and if you're eating too much sugar, reduce your sugar intake. Treat the cause. Okay, your diabetic medication is gonna do very little for you in the grand scheme of things. Okay, if you treat the cause, then you will be able to manage it much easier. Okay, so for gout, a lot of the time, pain control. And we spoke about that, the rice technique. Okay, if you've got a lot of pain, you can't really do anything that you want to do, so we're going to apply the rice technique. Everyone knows what the rice technique is?
Yes.
Okay, good. Okay, and then alter your diet to reduce uric acid buildup, and we spoke about that already. And then incorporate exercise to improve circulation. Your body is like a machine, okay? You need to keep on feeding it things. It's a living organism. We need to keep feeding it good things so that we can get good things out of it. Okay, that's why we breathe. When we breathe, we put in good air, and bad air comes out. Okay, the same with the diet as well. Water, exercise, that is how we keep our body healthy. It's all about the circulation that happens in the body. So when you drink a lot of water, it allows your body to flush out all of those bad things like the purines and the crystals and things that's causing your gout. Alright? And then massage. We're going to show just a 5-minute massage of how you can just help to facilitate the drainage away from your extremities, your fingers and your hands, and all the way down to the heart so that it can flush it out. Alright? And then rice technique, yes. If you have identified the signs of inflammation, then it is safe to use the rice technique. Okay? In other cases, like we're going to speak about in arthritis, maybe the rice technique is not gonna help you. Okay, we'll talk about that. But just remember the rice technique is for inflammation. Okay, the signs of inflammation, which is swelling, redness, pain. Alright, there will be pain at the joint, and it can have an increase in temperature. Alright, so compare the two sides. Alright. Okay, arthritis. So, what we want to do with arthritis, sometimes there is an inflammatory response in arthritis. Sometimes, it depends. So that's why you identify if there is inflammation, and then you treat it with the rice technique. Okay? If there's no inflammation, the rice technique is not necessarily going to help you. A lot of the times, people with arthritis struggle to move their joints. It's just painful to move it, but there's no inflammation necessarily. That's because of the cartilage that is degenerating in the joints. In that case, what I do for my patients is I put some heat in the area, in the joint, to bring some blood and liquids to the joint, so that it lubricates the joint a little bit. Alright? So put some heat on, make it warm up the muscles around the joint, in the joint, for about 10 minutes as well. 5 to 10 minutes, warm it up nicely. And then what you want to do, once you can move your arm, you want to do a little bit of exercise. You want to strengthen the muscles around the joint, because with osteoarthritis, you lose a lot of your function. Osteoarthritis or rheumatoid, you lose your function, and that causes the muscles also to deteriorate. And we don't want to do that. We want you to still live your best life. Okay? So once your joint is lubricated and you can move it, you want to do a bit of strengthening exercises for the joint, just to support the joint a little bit more. It's going to become much easier in the long run. Okay, but daily exercise is very important. Okay, and then, yeah, that is the differences. With inflammation, you don't want to put heat on there. It's going to make it much worse. Okay, so this is why we're talking about this, all about education, so that I can determine what I need to do for my joints. Okay, are there any questions? Okay, so I think everyone understood everything, yes?
The tea that we're looking at now, is it just for arthritis? The inflammatory, is it just for it?
So she asked the tea, is it just for inflammation? Is that your question?
Yeah.
Okay, so the tea is predominantly for inflammation. Obviously, it also has many other health benefits, because each ingredient has a whole list of things that it can help with in the body. But in that combination, yes, it helps with inflammation of any sort. Okay? So inflammation basically is just an indicator that there's something wrong in the area. It isn't necessarily only for gout and arthritis. Inflammation can be a whole host of things. What you need to understand also is that if there is inflammation or if there's a fever or something, like if it's hot to the touch, it's not a bad thing because that is your body's response of trying to work out the toxins. When it does get serious is if your temperature gets too high. But you want to have heat in the area because then you know your body's fighting whatever the problem is. Okay? So just to recap on what Sean said, gout and arthritis are two different things, but they have very similar attributes. Okay? So what you can also do on top of tea and the effleurage, which is the little motion of massaging that you do, is that you can use a hot pack or a cold pack. So the hot pack you use for arthritis basically because you want to bring heat to the area so that it can ease your muscle pain. It doesn't fix the problem, but it eases your muscle pain and it helps with the inflammatory response of getting the toxins out. You know, bringing the blood to the area and getting it out. Because the whole thing revolves around you need your blood to the area where there is a problem. That is the main thing. Okay, and then for gout, you use a cold pack because that is to help with the pain and the swelling. Because it's two different things, so you need to know when to use what. But with arthritis, you can also use a cold pack, so you need to alternate hot and cold because you want to restrict the blood vessels so that it can push the toxins out, and then you want to open it up again with the heat so that it can bring more blood to the area. So that is the differences that you need to understand. So what I made is a herbal salve. It's completely natural and it's used for muscle pain, joint pain, and any type of pain basically. It's not only for arthritis and for gout, but it's also for whatever aches and pains. There's also cell regenerative properties there, so it helps restore cells that have been broken down through this whole process of pain and so forth, like Sean explained. So if you have pain in your area, you can just put a little on. What we would advise is, if you do have an arthritic or a gout attack, first put some of the salve on. So you just warm it up a little because it's made of coconut oil. So you warm it up a little so that it can spread on smoothly. Okay, and then you spread it all over the area where there's pain, and then you do your little massaging technique, which will just be slight butterfly strokes in an upward motion, just to get circulation going, and that is called effleurage. And that is what we are going to do now. So we are going to give everybody, if you want, 5 minutes of just doing that, is to just get the blood into the area, get the circulation going. We're going to use the salve as well so that you feel the combination. What will also work best is when you put the salve on and you've done your effleurage, put the heat pack on so that you have as much of the process for the blood flow to occur happening in the area. So those are the 3 things that you can do. So everybody, thank you so much for coming. We really appreciate you. Sorry? Oh, the ingredients of the tea.
Yes, and like the water, what do you put tea bag?
Okay, so what you can either, sassy, there's turmeric, there's black pepper, ginger, and honey in there. So you can just use like a half a teaspoon of turmeric if you have the powder, or if you have the actual root, you can just cut a slice, and then you can just put a dash of pepper. You don't need a lot of, it must be black pepper, because black pepper contains pepperin, which is what activates the curcumin in the turmeric. Okay? So you cannot use turmeric without black pepper, but you don't need a lot of black pepper. Yes, you can use the shaker in the ground, or you can use the fine pepper. It doesn't matter. Then the ginger, you can either use the raw ginger, cut a slice, or the powder, whatever you have. Also just half a teaspoon or a teaspoon depending on your taste buds, because for some people it's too strong, others the more the better. So whatever your palate allows, that's as much as you take. And then as much honey, you can't have too much and you can't have too little. Again, it depends on your taste buds and what you can handle in a cup of hot water. And you can have it as often as you feel you need to. Your body will also show you and tell you, is it working, isn't it? Is it too much for me? Doesn't this work for me? That type of thing. Because not everything works for everybody the same way. Because everybody's bodies are different. So this is just a general idea of how this concept and process works in majority of people. Any other questions? No? Okay, so then I think we're going, those who still need to do screening, please go to the respective screening booth. And then if you want to stay for the massage, it will just be 5 minutes each. There's going to be 4 of us at the back. So I think from the first row we can go and have